Welcome to the Pet Health Unlocked podcast. I'm Alex Pearson and joined by my good friend, Keith Weingart, Dr. Keith Weingart. And we're here to talk about allergies today. It's a subject that we get questioned about on social media all the time. It's also a topic that Dr. Weingart gets asked quite a bit. What brought it up is my dog March. We were out for a walk the other day, and we got home, and he started sneezing uncontrollably. And he's not a sneezer. You know, he'll sneeze like a normal dog every once in a while. But he started sneezing over and over and over again. And I started to laugh because I thought it was kind of funny. But about minute 3 or 4, I started to worry a little bit about him. As you can imagine, I was like, dude, what's going on? And what he had smelled or what he got into. And so I started thinking, you know, when you're out for a walk and you're with your dog, or, you know, let's say he's off leash and he's out there rummaging around. Sometimes you don't know what they get into. So I thought it would be a good topic for us to talk about today. Seasonal allergies, you know, they're dogs that deal with licking paws or skin or their ears, or, you know, sometimes they're dealing with in April and May. But Dr. Weingart, what's the root cause? What is the main thing that you tell people, you know, what causes allergies in animals?
Well, Alex, it's a very complicated question. And it's one that I have to deal with almost on a daily basis. And in essence, if you want to boil it down to a simple description, allergy is when your immune system overreacts to things that it normally shouldn't. So these are things that are normally in your environment, whether it's dusts, pollens, molds, grasses, trees, weeds, all those types of things, which you're exposed to all the time. So if you have an overactive immune response to those antigens, that's what the real true definition of an allergy. So and if you want to get even more scientific, it's an actual IgE-related, immunoglobulin-driven reaction of your immune system to antigens. Antigens are things that are foreign that your body perceives as it scans and surveils for these antigens and then has an appropriate response. And if we have too much of a response, that's what allergy is going to be. Now, with you and me, we tend to have allergies. They manifest oftentimes with hay fever, sneezing, runny eyes, itchy eyes, that kind of stuff. I suffer from allergies living in the Northwest, and that's kind of my main symptoms. With dogs and cats, we tend to see more reactions around allergies that are manifesting in the skin. Now, if you look at it, when you boil it down, allergies can oftentimes have genetic component to it. So certain breeds of dogs or certain dogs where their parents may have had what's called atopy. Okay, atopy, A-T-O-P-Y, is the genetic predisposition to being hypersensitive to things that are ubiquitous in your environment. They're everywhere. And those can be things like I mentioned, dust, pollens, molds, things that are kind of everywhere. But we also have allergies that can manifest, or allergy-like symptoms that can actually be rooted in imbalances in your intestinal tract. So what we can see with some dogs and cats are food sensitivities, and then we can actually have true food allergies, where those animals are reactive to the point where they eat a food and it causes histamine release and all the classic allergic type of symptoms. But there are also conditions that we see frequently in the intestinal tract. One of them, I think we've talked about before, is called leaky gut. Okay, so leaky gut, it means there's low-grade inflammation in that intestinal tract. So what happens is that barrier function. So normally in your intestine, all the cells are tightly adhered, okay, and they prevent any food antigens or toxins from making their way into the bloodstream. But if that barrier is compromised from inflammation and abnormal balance of bugs in the gut, all those types of things, those antigens get presented to the bloodstream and they can manifest with allergic symptoms lots of places besides just the gut. So those are patients where we see itchy ears, ear infections, anal gland problems, chewing on the paws. So it's kind of really complicated the allergy question, because trying to figure out what's the trigger can be a really, really challenging dynamic. And I think that's what is most frustrating for people with their pets who have allergies, as well as for veterinarians. And now, where we are at with conventional veterinary medicine, the treatment has become bigger and bigger guns to suppress the immune system so it no longer reacts in the way it is. But unfortunately, while it may be beneficial to control the symptoms, it's not doing absolutely anything to address the underlying allergy. So we're just turning off the itch and not addressing why the problem started in the first place. Sure. So that's where I think, if we want to be critical, and we can talk a little bit more about this, is the first line of defense is look at what they're eating. Get their gut in a good place. And then the next step beyond that is how can we work with the immune system to wind it down a little bit, take some of that overreactivity out of there and modulate, balance the histamines rather than just turning everything off.
So do you find in your practice, do a lot of animals develop this over life or over a lifetime? Do you see a lot of 3 or 4-year-olds coming in and it just started? Or do you typically see dogs that deal with allergies deal with them from a young age on?
I think it's a great question. And I think what I see mostly is dogs less than 2 tend to be more having food sensitivities where their gut may be off. They have more leaky gut type of stuff going on. And then once they hit around 2 years of age, that's when dogs with true atopic dermatitis, where they're almost genetically predisposed to having this problem, that's when we really see those symptoms start to ratchet up. But there can be some pets who we see who've spent their whole lifetime kind of like not really necessarily allergic, but start to have further and further immune system challenges because on some level, somewhere along that path of their journey towards health or not health, their immune system got turned activated in the wrong way and became overreactive to things that it normally shouldn't be. And that's sometimes we can see that with deeper immune diseases like autoimmune conditions. Sometimes we see cancer patients whose immune systems are so challenged by the hard work they're doing to deal with the cancer that their immune system spins out and starts becoming allergic to things in their environment. So again, you can see from how I kind of talk in circles around this that it's a really, really complicated thing. And no matter how you approach this, whether you're going to be doing it conventionally or through any integrative modalities, there is really no easy answer for allergies.
Sure. I mean, you look at when it is happening to them, it's almost like when you're looking at your own kids at times, or even your spouse or someone that, like you said, in the Pacific Northwest that's dealing with things, sometimes you just wish they could look at you and go, this hurts or this itches. But you certainly have to start somewhere. And it always seems to come back to the gut. And to wrap it up, Dr. Keith, what would be your protocol if you were to have somebody come in and not a terrible situation, but one of, they're itching more, licking their paws. What's a good baseline for them to start? What are some good products we can offer them?
Yeah, it's a great next segue. And so the way I look at it is the more whole, real food that you can feed to your pet, the better off they're going to be. And this is true very much in the allergy department too. So if we're feeding a highly processed, diet like kibble or those types of things, that in and of itself can create toxins that the body has to deal with. And it also makes a very unhealthy gut. And when you have an unhealthy gut, the immune system can get triggered and we can start to get what I mentioned, leaky gut. So starting with the fresh whole food diet, oftentimes if an animal is say really showing a lot of allergic symptoms and they're on a specific food, the first thing I do is say, let's get them off that food, change them to a new protein, find something that they haven't been exposed to before and introduce it in a fresh whole food form. And then while I'm doing that, I oftentimes want to make sure there's not any subclinical or ongoing inflammation in the gut. So my favorite supplement is Thornvet's Gut Health Formula. That is like a foundation. Even though an allergic patient may not have gastrointestinal issues, that's a really good way to help ensure that we can reduce inflammation in the gut, seal up those tight junctions, and then repopulate the intestinal tract with healthy organisms.
Yeah, I mean, if you don't have the gut, what's the point of anything else? I mean, you can put anything in your gut, but if you don't have something that has, effectiveness and can get through the body, what's the point? Why don't you speak on longevity a little bit? That's my favorite product that we have. And Dr. Keith is the formulator behind it. But I know longevity isn't just good for allergies, it's good for a lot of other things. But if you could just touch on longevity and how that helps with allergies.
Sure. So I think, in the Thornvet line of products, there's a lot of different things that may be able to help with allergies. And each of them is going to bring a little bit different benefits to the game. And trying to find which ones may be the best for your pet can be a little bit complicated. So as I mentioned, starting with getting the gut right. So our gut health formula, potentially our probiotic support formula, those things are going to be kind of really fundamental. But when we have your immune system, or you're having what we call inflammatory dysregulation, your body is overreacting to things, or your immune system's overreacting to things, we want to tamp that down. And there's a few things we can do to help do that. And one of the ways is to try and help modulate inflammation. And when we designed Longevity Formula, that was designed with the premise of that we know that at a lot of the root of chronic diseases in the body is inflammation that's gone dysregulated. So we used ingredients in that formula like curcumin and quercetin, two really potent polyphenols that are interestingly very, very helpful for allergies. Quercetin and curcumin are what we call polyphenols, and quercetin is a flavonoid polyphenol, and it comes from fruits and vegetables, and it has this beneficial effect at modulating histamines. And curcumin also has been found to be really helpful for tamping down that overactive part of the immune system. I like to, just for those two ingredients in longevity complex, that's going to go a big, long way to helping. But the other thing is that many of these patients with allergies are really dealing with a lot of stress on the system, what we call oxidative stress. So a lot of toxins, accumulation of toxins from the gut. When the liver has to deal with all these antigens, it gets burdened too. So remember, supporting the liver is really helpful. But also we want to look at how can we unwind that overactive immune system. Magicare Vet is a great option in that regard. It's probably one of my favorite things in the Thornvet line to help with allergies, because it's a very simple formula. It's just a combination of two plant sterols. But plant sterols as a group of compounds helps tamp down that overactive part of the immune system and it also tonifies or strengthens the deficiency that allows for the allergy to get in there in the same place. So a combination of Magicare with a little bit of longevity complex. Interestingly, also, we mentioned a lot of times Super EPA Vet. Okay, omega-3 fatty acids are really, really helpful for modulating inflammation, but really important for helping maintain the integrity of the skin. And since dogs and cats like to manifest their allergies in the skin, it makes sense to support that. And another thing that we've recently added to the line of the Thornvet line of products that is really helpful for allergies is colostrum. Okay, colostrum comes from the first milk in the mom cow. All right, and it's full of immunoglobulins, lactoferrins, all sorts of other really helpful immune compounds that work in the gut to make sure that there's a really healthy bowel environment, but also works at the immunity at mucosal surfaces. So helps that skin, helps the respiratory tract be healthy and balanced in their immune system response. And it can go a long way towards alleviating some of those symptoms around allergies. Now, I don't recommend throwing everything in our armamentarium at your pet, dog or cat. Be specific and careful and targeted in how we're doing this. And look, let's work on the gut first. Then let's get some things that are going to help modulate some of those histamines and help that patient be comfortable. Because I can tell you that allergies as a condition are one of those diseases that are in the client's face. So like pet owners, we know our animals are allergic because they don't let us not know it. So they're constantly chewing and scratching, keeping us up at night, which is why there's such a huge market for these drugs that are so suppressive on the conventional side, because it's such a terrible set of symptoms. So this can be a challenge to work through, but find an integrative vet who can help you. We're always happy to help as well. And then the other thing I just want to say this real quick before I forget is that many times we're trying to figure out where allergies are coming from. Well, we're at a time where we actually have more advanced diagnostics now, where we can actually do what are called serum allergy tests, okay, as well as skin allergy testing to test the patient specifically for the antigens that they are allergic to. And then when we find out that information, we can actually use that to help create an allergen-specific immunotherapy. So we can help utilize those antigens that most likely cause problems in that patient, start them at a really, really low dose, and over the course of several months to years, we gradually increase the dose of those antigens, and that actually turns down their immune system's response to those antigens. Of all the things out on the market, all the things that I've ever used, that is probably the single most effective way to address allergies, because you're really truly getting to the root of why they're happening.
See, what I take away from this for all those that are listening, and especially what Dr. Keith mentioned, and it's important to find a Dr. Keith in your life. I think you could say that about anything, not just your own personal health, but your dog's health. And at times it's difficult to find that. And as Keith said, we are here to help, whether it's, gut health, Modicare, colostrum, immune support, but you need to start somewhere. And it's very important to understand and educate yourself. The one good thing too is, as Dr. Weingart was talking there that I thought of, is when you see your dog struggling and itching and licking his paws, when you do start to find a treatment that's beneficial, you'll see that licking and itching stop, hopefully, and you can see if it's working. They're not going to be able to tell you, but hopefully as you prescribe more and more supplements and learn more and more about allergies and have a Dr. Weingart in your corner or a Thorn vet, we can help you out with that. So anything else to add, Dr. Weingart, before we're done with allergies? Like you said, it's always in your face. It's always something you're going to be dealing with. But there are a lot of different protocols that we can at least start with and help with that journey of helping your dog out.
I think it's probably the most frustrating condition we deal with, both as pet owners, but also as practitioners. And it can be something that requires a blend. And I don't think there has to be an all or none philosophy about healthcare. And I think this is one of those avenues where, I call it, I check my ego at the door. And if from a humanity and a compassionate decision, that pet needs one of these pharmaceuticals that is more suppressive, that pet can get that, because we have to look at the overall quality of life and look at what's in the best interest of that pet. Now, we may want to do things to help mitigate some of those risks. And we may want to use things in addition to supplements to help support that pet so they're going to have the best outcome. But it doesn't have to be an all or none phenomenon. But as always, if we want to bullet this, is like start with the diet. Okay?
Sure.
It's the most important medicine you put in their body every day. Make sure the gut is healthy and then see what's left. And then if you're still having signs of excessive histamines, then we can utilize targeted nutritional supplementation to address that. And then the other thing I haven't even gotten into, there's a whole world of herbs that can be supportive and helpful. And I think one of the things that we're working on in the background here at ThornVet is to come out with a formula that can help support our allergy patients so that they can have one thing in one place that's going to combine a lot of these principles into one product. So stay tuned.
As always, and please send us questions about today's podcast. Like Dr. Weingart mentioned, breeds are different, ages are different. Bulldogs are going to be different than a Chihuahua, and so on and so forth. So we're here to help. Send us questions. Follow us on Instagram and Facebook. Check out our YouTube channel as well. And for future announcements, like Dr. Weingart mentioned. And pets are the best. We'll see you next time.
Pets are the best.